All right, so we did treat her for 5 minutes to restore transverse plane mobility through the pelvis, and you can see that I can take up the slack to an endpoint and that there is force transmission through that structure. And in terms of inferior glide with contact on the sacrum, it does load quickly, but I can still enhance mobility in that direction, staying well above the tailbone, the coccyx. I'm at about S4-5 junction. I can take up the slack. I can see movement through the lower extremities, and I also get additional movement when I apply a forward thrust, force transmission, and when I let go, there's a recoil. So this is behaving better. Let's go ahead and have you walk again and see if we note any change. So one could make the claim that that's restoring mobility in the SI joint. One could argue that one is simply restoring mobility that goes through that structure. One could ignore that whole aspect and state that we're restoring normative mobility of the pelvis as pelvis moves with the trunk and lower extremities. And I'm interested in improving function in the patient population. So the debate has less interest for me, and I think that we have a very pragmatic way of improving mobility. Go ahead and tell us how you feel.
It just feels different, just more emotion, I guess. I still feel very upright.
Good.
Much more upright than normal.
And I think that this was your norm before your car wreck. I think this is how your body functioned. You had a severe car wreck, broke the frame of a truck, of a Toyota Tundra, and that was quite a deceleration. How fast were you going?
65.
Yeah, I mean, that is just insane deceleration. Did that total your vehicle?
Oh, yeah.
And fortunately, that was a Hyundai Elantra?
Yes.
And so you were mentioning that the engine went underneath on a track.
Down,
yeah. Remarkable. So this is my argument for the debate about can we improve posture, and I would state that yes, when it is coupled with gain of mobility, that is taking the person back to their norm. I would submit that yes, we can do this, and I think this is one example thereof. So we'll stop filming here.